Hello, my name's Joanne. I'm one of the midwives and lactation consultants at the Breastfeeding Centre, and today we're going to talk about using a hospital-grade Medela Symphony pump or Symphony Plus. Thank you very much, Sarah, for joining us today and helping us demonstrate how to use the pump. So there's some equipment that we need to put together before we can start. So I know I've given you some there, we'll do it together. So essentially we've got a connector piece here. There's a cover and the connector. So can you see that there is a little area there, little bar that connector will snap onto, like that. Lovely. So it's got a little lid. And then our membrane here needs to fit inside the connector with the little duck bill, as I like to call it, pointing down the bottom. That needs to fit in quite snugly, okay, so that we're going to get a good seal. And then we just click the top down. Should hear a little click. That's it. All right, so now once we've assembled the connector, okay, we need to put the pump equipment together. So inside the pump, you'll notice that there's a place to put a little cap. So I'll give you one if you wouldn't mind. You just pop that in there. It just lines up with a little channel here, and we press it in, it should click. They can be a bit tricky sometimes. Excellent. Okay, so then we can pop the lid down. If you were needing to access those caps for any reason, you can just press this button on the top, little oval button, and that will release the lid. Once they're in there, you probably won't need to do anything with them unless they're lifting up, in which case turn the pump off, press the button, lift the lid, put the connectors back in and close the lid. Now the caps and the tubing that go with this pump, which is the newer equipment, these bits here don't need to be cleaned after every use, but all of the other equipment that we're using will need to be cleaned after every use. So anything that's coming into contact with your breast milk. So that will be obviously the parts of the connector, and you do need to pull it apart to clean it all properly. Okay, so you take those all apart, the bottle will need to be cleaned, and the shield, because these are all the bits that are coming into contact with your breast. Okay. The other thing to mention is that the tubing for the newer equipment has a longer beige rounded end. This will only fit into this type of cap because it has a rounded end. So can I give you one bit of tubing, and I'll put the other one in here, so it just fits into the end inside the cap that's inside the pump, and then our other end can fit onto our connector that we put together before, into that little hole at the top there. Can you see that? Oh, excellent. So then the connector is then going to fit onto the bottle. So if we can just screw that on like that. And then the shield that you're going to be using then fits into this part here, like that. And that's one complete set ready to go. Now you might notice that I actually have a few different sizes of shields here. We've got the 27 for you because that's the right size for you, but they do come in different sizes. 21 is the smallest, 24, 27, 30 and 36, and the right size is the size that comfortably fits on your breast, that doesn't cause any discomfort and allows milk to flow freely. So we've selected the 27 for you. Now you might notice that I've actually set this pump up so that you can pump both breasts at the same time, which actually is the most effective and efficient way to use one of these pumps. I'm going to talk to you about using these buttons in a second, and that might require you to have a free hand. All right, so when we're wanting to use this pump, there's a few buttons here. You'll see that this button here with a round circle on it, that's the on-off button. This button or knob in the middle increases and decreases the suction pressure. And this button to the side is what we call a bypass button. Now this is a Symphony Plus, which just means that it's got two different sucking action programs in it. So it has an initiate program and a maintain. The initiate program is designed to be used in those first few days after your baby's born to mimic the sucking action that a newborn baby does, which is essentially a combination of shorter stimulatory sucks and longer, more nutritive sucks. Okay, Whereas the maintain program is for the sucking action that the more mature baby does. So several days down the track, once your milk's come in and you're producing at least about 20 mils of breast milk or more each time you pump for at least 3 consecutive pumps, that's when you would want to be on the maintain program. Okay, so we'll run through how you would use those. Okay, so I might get you to pop those on your breasts if you don't mind, and then we can run through how to use the pump. Excellent. Okay, so this is the on-off button. So to turn it on, we're going to press this. Now what you will see come up in a minute is it will say initiate press, and it will have a little picture of this milk drop. What it's saying is that if you want the initiate program, you have to press this bypass button within about 10 to 20 seconds. Otherwise, it will just automatically then go to the maintain program. So we're going to turn the pump on. See how it says initiate press with a milk drop? So that's where we press this button, and it will say initiate running in that little window. Can you see that there?
Yes, I can.
Okay, so as I said, this sucking action of this program is going to be some short, quick sucks to stimulate the breast to get milk flowing, and the longer, stronger sucks, which is designed to kind of get milk moving. All right. So at this stage, you would just turn the pump on, let it do its program, usually for about 10 to 15 minutes as a guide, but essentially until your breasts feel nice and comfortable and not lumpy or sore. Okay. If there was an issue in one breast where you had a little lump, you could always take one off and then just spend a little bit of time doing one at a time and just gently rub over where that, or massage over where that lump is. And then gently massaging towards your nipple. It is important that you do that quite gently, not really digging in and pushing hard, because that's just going to make your breast sore, and it doesn't get your breast to move milk any better by doing that. So just really gentle stroking or massage over that area. Okay? All right, so in those first few days, your breasts produce colostrum. There's not a lot of volume to colostrum, so you might not get a letdown per se, but we would just do the pumping for about 10 to 15 minutes.
Sure.
Okay, and then obviously whatever you get, you'd then give to your baby. When we turn this pump on, it will say in this little window, initiate press with a little milk drop. So if you want the initiate program, you would need to press that button within about 10 to 20 seconds. But once you're starting to make more milk, so usually once your milk comes in, which happens generally after about day 3, day 4, your breasts will start to feel heavier, you'll see more milk being produced and able to be removed. You want to be on the maintain program at that point. So the way you access that, and I might get you, if you don't mind, to pop the shields onto your breasts, and then we can turn the pump on. Lovely, and we're centering those over your breasts so that we're going to get even pressure over your breast tissue. So we'll turn it on with this button, and you can see it says initiate press with a little milk drop. We want the maintain program though, is to just wait the 20 seconds, and then do you see that it's just got a couple of little milk drops? So it actually says maintain running, and then just you get 3 little milk drops.
Okay.
See, maintain running?
Yes, great.
Okay, so now we know we're on the maintain program. Now, just so that you're aware, that's its default setting. You can actually turn it down to 1.
Okay.
So the idea is to always start lower, at a lower pressure rather, and slowly turn the pressure up, okay? Because we don't want it to be too sore for you.
Yes.
And we want time for your breast tissue to accommodate to being stretched.
Yes.
So start low, and then we slowly turn the pressure up until we reach whatever is the highest comfortable pressure for you. Comfortable being the important word there. We don't want it to be too sore, because you won't let down very well if you're in pain. Okay, so how is that pressure for you? Is that okay, or a little bit too high?
No, that's fine.
That's okay?
Yeah.
All right. So what we're waiting for is for your breast to have a letdown, or for the milk to start running, which looks like we're starting to get now. Well done.
Yeah.
Okay, so you can see that it's on the stimulatory at the moment because it's got that little milk drop symbol, but we want to then switch it over once you get a letdown, so once milk's flowing well, to the extraction. So we can do that by just pressing this bypass button. So if we press that, can you see that the symbol has changed to a little bar? Okay.
Yes. Yeah.
Be careful because it does tend to just jump up on its own, unfortunately. It's just a feature of the program. So just make sure that you turn it down so that you're on a comfortable level for you. Is that okay?
That is comfortable, yes.
Okay. And I don't know if you can hear that, but it's a kind of a longer, stronger sucking action. Can you feel that? Right, so this is the sucking action that is designed to remove milk from the breast. So it's a bit like when the baby first goes on the breast, they do those quick little sucks to get you to have a letdown, and then they switch over to doing those longer drawing sucks. So that's what this sucking action is trying to do, or to mimic.
Yes.
Okay, so while the milk's flowing well, we're just going to stay on this one. All right. If you notice in a little bit that the flow of milk has slowed down again, then we want to tell your breast to have another letdown, much like what your baby would do when your baby's feeding at the breast. So we can just press this button here, go back to the stimulatory.
Yes.
And what we're waiting for is for your breast to have another letdown, so milk to start flowing better again. And then when it does, and you can just start to see that it's starting to flow a little bit more quickly again now. So we're getting another letdown. So that's the point at which we would then press this button again and take you back to the extraction. So switching back and forth between those two different sucking actions is essentially using the pump to mimic what your baby does at the breast when they suck. So it's a much more effective and efficient way to use this pump and to remove milk from your breasts. So that's how I would suggest that you use the pump if you're needing to, especially if you're needing to build supply or you're pumping frequently. Okay? And is that pressure okay for you?
That is, yes, comfortable.
Excellent. If it takes a little bit longer, you can do it for a little bit longer. If you find that one breast is nice and soft, but you've still got a bit of a lumpy area in one, you can just take one off and do each breast singly for about 5 minutes. And just very gently, wherever you feel a little lump, just massage over that and then massage towards your nipple so that we can help move that milk out of your breast.
Okay.
Okay?
Thank you.
Excellent. All right, I'll just pop that off now. Thank you very much.